guys, welcome back to Medical Coding with Blue. Today's episode is going to be all about breaking down the different versions of medical coding books, okay? Now, before I begin, I'm just talking about the Optum360.com coding books and also the AMA, the CPT book for professional edition, okay? That's all I'm going to talk about today. Now, there are different publishers for these books, but they may not have all of the information. Their information may not be quite as comprehensive. I'm just talking about the ones that I know, okay? These are the ones that I am most familiar with. And this whole video is not an ad, although it will sound like a very glowing ad because I love Optum360 coding books. Now, it's not an ad, but Optum360, if you're listening, call me, okay? We'll talk. Anyway, there are many different types of books. Now, it's important to know what these abbreviations mean, okay? Now, I will be leaving the link for Optum360 coding down in the description box below, along with my contact information and along with some of the abbreviations, what they mean. Now, you can also email me. I will include my link down, my email address down in the description box below. And if you're new to my channel, thank you so much for joining me today. I have been a medical coder. I am Blue, okay? I have been a medical coder for over 10 years. I like sharing the things that I know. And so hopefully my channel will help you either as a veteran, you know, or that you have any questions, or that you are a brand new person on your journey into medical coding. So like I said, if this helps you, please give it a thumbs up and like and share at the end. And let's get started. Okay, so there's your diagnosis book and your procedure book and your HCPCS books, right? HCPCS book is the durable medical equipment and all of your wheelchairs and things like that. They have their own book for their own codes, okay? But let's start first with the diagnosis books, okay? So you have your ICD-10-CM, okay? There's two different kinds from Optum360. There's the expert for physicians, and then there's the expert for hospitals. Now, I use the expert for physicians, okay? I am on the outpatient side of the house. I don't need all of the extra information that the expert for hospitals has. So the expert for hospitals has the MS-DRG edits. It also has the CC and MCC symbols. It also has the like hospital acquired conditions, which the expert for physicians has that, but it has a little note about that. But this one also includes the HCC little notation as well. Now, again, I will leave like the abbreviations down in the description box below so that way you guys can see it. But like I said, the expert for hospitals is more for like the inpatient side of the house. It's going to give a little bit more of the edits and a little bit more information about things that inpatient coders need to know, like about the reimbursement side of the house and things like that. With the expert for physicians, ICD-10-CM, like I said, it's more on the outpatient side of the house. It's got a lot of comprehensive information. Both of these books are really good. One is just more handy for information for whichever particular setting. So for me, that I'm in the outpatient side, I use the expert for physicians. Somebody who is, you know, coding an inpatient would be wanting to use expert for hospitals, okay? So you will be able to know if you are sitting for an inpatient exam, obviously, because you will learn the PCS coding, which I will bring up in just a minute. So moving right along, that's the difference between those two. So the physicians is for the outpatient, and then the hospitals is for the inpatient side of the house, okay? Now, for the CPT, there's the CPT Expert Edition, and this is going to have your CCI notes on it. It's going to have your CPT Assistant like little notation where you can find the CPT Assistant. And CPT Assistant, if you don't know, is like the coding clinics that will help you to understand or further clarify what you need to know about that code, or if there's something like a question somebody asked, it will be in the and the CPT assistant, okay? And it's going to refer to MUEs, which is medically unlikely edits. Like if there's like more than one, like just say for instance, it is a bilateral procedure, and obviously medically unlikely would be like 3 units for that one. That's the kind of thing that they're referring to with that. And it's going to have just different Medicare icons, and that's going to make it easier for somebody who's doing a lot of the billing. Okay, so if you are in the position to be doing that, obviously you're going to want that CPT Expert Edition, because it's going to give you all the little symbols that will help you to better understand what is the information on this particular procedure, okay? And then it's got Medicare icons for practices, outpatient, hospitals, and ASCs, which is ambulatory surgical centers, okay? Like basically like your same-day surgery stuff, okay? And then you have your CPT Professional Edition, which is the one that I use. Now, if you are sitting for any of your exams, that's the CPT book that you need, okay? You cannot use the CPT Expert Edition. For every credential I have looked at, they all say that you need the CPT the CPT Professional Edition, okay? Even AAPC, okay? So both AAPC and AHIMA, those are the 2 major medical coding association powerhouses, okay? AHIMA is the American Health Information Management Association, and AAPC is the American Academy of Professional Coders. Both of them, if you're going to sit for their exams, they have a list of approved books. They will tell you that you need the CPT Professional Edition, okay? Professional Edition for the CPT book, okay? So remember that. I have a picture of it on my Instagram page, Medical Coding with Blue, okay? So that way you guys can see it. But yes, and that one has a lot of good information. It does talk about what you cannot code together, and that's the CPT Professional Edition. The Expert Edition does that as well. It doesn't have, the CPT Professional does not have emphasis on RVUs. That's the Expert Edition. The CPT Expert Edition is going to be talking about those RVUs. And RVUs, if you don't know, is relative value units. That is basically what the weight of that procedure is. I was going to say the hospital. That is basically what the weight of that procedure is, because as we all know, insurance companies will charge whatever they want, okay? Or they'll pay whatever they want, basically. So for the hospital to have a standard across the board of how much production and how many RVUs are being generated by a particular provider, each one of these procedures is weighted, okay? And so because of that weight, anytime that provider performs that procedure, they get that RVU, and that's called RVU generation, okay? And they get RVU generation for their evaluation and management levels. They get it for their procedures they perform. So it's only on that. It's not on the diagnosis. So we're not talking about that. That's something completely different, okay? RVUs has to do with the procedures and that side of the house, okay? So that way they know how much are they generating, okay? It's not going to be about like, well, this provider, you know, had this much revenue coming in from this insurance company. It's not about that. Like I said, insurance companies are going to charge, or they're going to pay out different amounts. But when it comes to knowing exactly how much revenue that provider is generating, they're going to be looking at RVUs, and that's how they can measure rates for production. That's how they can decide on things like bonuses and things like that. So, and that's why you'll sometimes hear them say, well, my RVUs are down and, you know, whatever. And they'll say things like that because, you know, everything that they do is, like I said, it's weighted, you know, from their evaluation and management levels to the procedures that they perform. So that's why it's very important for them to have complete and full documentation as appropriate, because when they are not doing this, that's when they can lose money. And I talk about this a lot. We as medical coders do not code for money, okay? If we know that they can make more money doing this other thing, or if they documented it this way, they'd be able to make more money. That's wrong. Okay, we don't do that. We make sure that what they are doing, they are documenting so that they can get paid appropriately, okay? Because we're not looking to try to code based on money. You don't do that. And sometimes providers will want a higher level, and they will insist that you give them a higher level. But if the documentation is not there, it did not happen. And you do not give them a higher level if their documentation is not showing or supporting that level, okay? Just because they want higher RVUs, okay? It doesn't matter. They need to make sure that they're documenting appropriately. And this is why I always make it a point of saying they have to document appropriately, okay? So, but yes, that is what, okay. And then you have your ICD-10-PCS expert, okay? Now, the PCS is for all of your inpatient procedures. Anytime the patient is admitted to the hospital and they have to have like a joint replacement done and they're going to be there for a few days, that is when they're going to be under that, okay? Then you would be building the code. With the CPT book, you don't build the code, you select the code. The codes are already there. There's already 5-digit code, right? And it's telling you basically what this procedure code, what this is. 20610, which is an arthrocentesis of a large or major joint, okay? That is an injection into a large or major joint. And that is telling you that that is what that code is for. 20605 is for a medium joint, injection or arthrocentesis into a medium joint, okay? Same thing for, a smaller joint or whatever. So there's those that are, you can sort of, if you work in certain areas, you'll get familiar with that section of the CPT book, and that's how you can sort of know what direction to go into. With PCS, ICD-10-PCS, you are building the code, okay? So it's not always going to come out the same. Sometimes if the approach is going to be different, whether it's through like an endoscope or if it's, just different approaches, different reasons, why are you doing it? And it's broken down. Now, I have spent my career on the outpatient side of the house. A lot of people say that the inpatient PCS coding is much easier than the CPT. I have to disagree on that one. Maybe I didn't have a really good teacher back then. I'm working on it, guys. I already said I'm working on it now. But back then when I was learning the PCS, I was like, what the heck is this? This is confusing to me. I'm like, I will gladly stay on the outpatient side of the house. But of course, you guys know, I have to be an overachiever. So because of this, I did take the PCS and I'm like, wow, this like, it just completely, and so back then. And so now it's just like, I still prefer the outpatient side of the house because you have to build this code and you're putting different letters and numbers, you know what I mean? You're building the code itself. And so it's I don't know. To me, it's just different and it's weird. Honestly, it's weird. And some people will say that they feel like CPT is weird, but I guess it's just depending on, how you were trained and who trained you. Because having a good teacher, it says it all. It can literally either motivate you to learning more or it can discourage you completely. So it is very fickle. It just depends on how your approach to learning is, okay? But yes, that is the PCS book. So please don't confuse ICD-10-CM and ICD-10-PCS, okay? So PCS is for your procedures that are performed in-house. And ICD-10-CM is all of your diagnoses, okay? So that's the difference between the two. And then finally, I know I mentioned it a little bit ago, the HCPCS, the HCPCS. You have to check to make sure, but like with the HCPCS books, it's just categorized by like bandages and things like that. So like if you're looking for a particular bandage, a lot of times HCPCS codes are on the box. Like if you ever get like inserts from a podiatrist, it will usually say on the box what the HCPCS code is. And that is the particular HCPCS code for that product, okay? So some have a generic HCPCS code. Some have a very specific HCPCS code. So like for, like I said, inserts, it will be actually on the box. Now, if when we go back to the hospital, I will probably take a picture of one of the boxes so that way you guys can see what it is and what it looks like, because we have them in the clinic. And that way I can show you guys where it is on the box. Because a lot of times when you are working in a facility, and whether it's on the outpatient side, right? Just say you're working on the outpatient side, and maybe you're working in the podiatry clinic, and they're going to be issuing these inserts to the patients, and your provider asks you, how do I find the HCPCS code for this insert? Then you can show them on the box, because a lot of times providers don't know that the HCPCS code is actually on the box itself. And then if you can't find it on the box, you can always Google it. And then if you can't find it through Google, then you can just look through the book and see if there is a generic code that will classify to that particular product, whatever you're trying to say that was issued from the clinic. Okay, so it's very important to make sure that you're making note of those things, because sometimes like these devices and these inserts and things, they're ordered from the hospital money or the clinic's money or the clinic's budget or whatever, and they need to be able to keep track of all of that, okay? And not to mention, they need to make sure that they keep track of what they're issuing to the patient, okay? Sometimes they may switch from one type of insert or one type of product to another, and they need to see, like, you know, how did they react to this one, or how did they react to that one, okay? Not all places do this. Sometimes they'll send them out to like another carrier to get their equipment or whatever. And I've seen them. They have to send out the patients sometimes to have custom insoles made, and they get their foot measured by, you know, somebody that does that, an orthotist. Yeah, I think. Guys, with these words today, I am just like tongue-tied. I don't know why, but like I said, I was running around and that's what got me. So but anyway, I wanted to get this one up before time, because like I said, I don't like being late and I hate it. So I want to make sure that I'm there with you guys, because we are celebrating today. We are totally celebrating. Last year on this date, I hit 100 subscribers on this date last year. 365 days ago, I hit, or 366, whatever, because the leap year. I hit over 100 subscribers, and now we are over 3,200 subscribers. So I think this is amazing, and I can't thank you guys enough. So thank you, and here's to the next 3,000. Okay, but yes, so that was my scroll moment of the day. But anyway, yes, that is all the breakdown of the different books. Take your time and explore Optum 360 coding. Optum 360 coding does have lots and lots of sales. Now, I noticed that they like to have their sales around holidays, and maybe that's just me because I sort of look there a lot. I'm a book nerd, okay? Don't judge me, all right? Anyway, if you're interested in looking for some of those, check it out. When you are going to take your, I did wash my hands. When you're going to take your exam, make sure that you are looking at the list of approved books. I am going to be leaving the candidate link for AHIMA credentials down in the description box below. That way, if you guys are sitting for AHIMA credentials, you know what it has to say about the tests and things like that. I will be doing another video particularly about the number of questions and the minutes, because I found out today about the CCA. It's not 4 hours, it's 2 hours. Okay, you have 2 hours to take the CCA. Now, I'm gonna, like I said, I'm gonna do a whole video about that, but I just wanted to go ahead and put that out there, okay? Because some of the other exams are 4 hours. They're not all 4 hours. Some of them are a little bit less than that. So I will be, like I said, I will be doing a separate video about that one. But tomorrow is going to be Q&A Tuesday. And if you have any other questions, let me know. They're going to be tacked on to next week's Q&A Tuesday because your girl already did the Q&A Tuesday episode. So, because it was a good one, okay? But I already did the Q&A Tuesday episode. I will be back on time tomorrow, okay? 7:30 Central Time. Just saying. And, but yes, that was all the books. So hopefully that cleared up some things for you. Like I said, I will leave all of the information down in the description box below. And again, I'm sorry that I don't have the actual books to show you. But like I said, in my Instagram or on my Instagram, it has pictures of the books that I use, okay? And that PCS book was a screenshot just so you guys know what you're looking at. And I do say in the description that it is for the inpatient. The PCS is for the inpatient procedures, okay? But I'm going to go ahead and wrap this one up. But so if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all on the next video. Bye!